your dosing protocols. Okay, let's talk about those, your preferred method of delivery, how
I'll
you
be glad to.
dose.
Be
Yes.
glad to. All right, so I give testosterone two ways: injections or cream. Now, look, there are other methods of delivery, which I tell everyone, I just don't find them as efficacious. So I find that a daily utilization of either injections or cream works the best from a clinical standpoint. I like a stable level of free testosterone with a minor little sine wave, not any significant peak or trough. Now, so they get to choose which method they will utilize, and the differences are just this. Number one, the cream is just much easier to travel with. You don't have to travel with needles, syringes, and vials. Number two, the cream, as I've already discussed, will raise free testosterone levels for any given total better than the injections. Number three, the cream will not have a negative effect on the HDL cholesterol, where the injections can in some men. And then the cream tends to have a better effect on sexual function in a lot of men. And that's not from that serum DHT we hear so much about, but it's because it raises free testosterone levels better that are once again converted into DHT. Most men don't inject daily. So if they're not going to inject daily, I recommend every other day or no less than 3 days a week. I don't even prescribe it less than 3 days a week because I want great clinical success. The thing about the cream too is if a man doesn't inject daily, the only way to compare injections to cream is daily of both. So when a man does daily cream, he's got a stable level of free testosterone. There's not a big drop, maybe a 25% drop at 12 hours from the morning application. So if you go from 1600 to 1200, whatever you may do, just a nice little sine wave, but you stay above the saturation point. The whole method of delivery and what you're trying to accomplish is there's a minimal effective concentration, which is a line. You want to get above it and stay above it, and you want to get to that saturation point where you get the maximum benefits of testosterone. You don't want to drop below the minimal effective concentration. I'm a big proponent of the scrotal cream. Men out there will tell you, I read it all the time. I get a laugh about it multiple times every day. Yes, I have men on injections. I'm not saying injections are not good. 90 to 95% of men on injections are fine. They don't mind it. 5 or 10% don't like it for whatever their reason is. The same holds true for cream. 95% of men love it. 5 or 10% are not going to like it for whatever their reasons. Now, I probably have more, well, I do. I have more experience with the cream than probably anybody in the country at this point in time. Been using it longer than anybody. And every different base you could think of, and so every different timing of when to test levels. So the cream, what I try to tell people is that, look, yes, injections work. We know that. But what I try to get across is that there is another method of delivery that is just as good, if not better, for many men than injections. Okay, and so that's the key. I dose it twice a day, the cream twice a day. I use a scrotal application, so it's twice a day, and I measure levels 5 hours after application, and that's kind of how I dose it. I dose it based on symptomatic improvement, and if I had and so people say, well, doctor, what levels are you aiming for? I don't aim for any level. I don't aim for a level. So let's all be clear here, because you asked a really good question earlier. So I don't aim for a level. I start on the dose that I find that gets most men where they tend to be in the most efficient amount of time. And then I'll measure the levels and follow up their symptom questionnaire. If I looked at a bell-shaped curve of where most men were when they had symptomatic improvement, their levels would be a free testosterone of 30 to 60. Yes, that's correct. So once I get that level, once their symptoms have improved or resolved, then once again, raising it higher than that is going to have no additional effect unless you're going to use it for abusive bodybuilder person, which we don't prescribe it for that. So that's kind of where I sit with my dose. I do the same thing with the injections, looking for the same free testosterone levels exactly.